Hello, and welcome to another episode of Disruptive Dental Science. I am Dr. Sabiha Bunek. I am the CEO and president of the Dental Advisor, and it is a true honor to have my friend and colleague, Dr. Tiffani Dunn, here joining us today. Hi, Tiffani.
Good morning and aloha.
Aloha to you. So we've got a time difference here. I was going to say it's in the afternoon here for us, but how many hours are we apart?
I believe we're six right now, so we don't ever change time. So when you do your fall back, we'll be about 5 hours. So that'll be
Oh,
good. A little
okay. Then we
closer.
can start talking on the phone a little more and
That's
things like that.
right.
So, Dr. Dunn is a fellow COIS graduate, and she's also a candidate for the AACD. And for those of you who know, that's a great accomplishment. So, how far are you in the journey?
So this accreditation journey is pretty grueling. I finished all five of my cases, and I'm just waiting to take my oral board exam. And then after that, I will get my medal in April, hopefully.
Wow. I mean, that's a huge, huge accomplishment. And for those of you who are listening who are curious more about, I mean, how long does this take someone to do? Like, do you generally start out of dental school? Did you start a little bit later?
I don't think I would have even had the hand skills to even try to start right out of school. I think it's just baby steps. You're just kind of
Yes.
learning how to swim out of dental school, right? So,
Yes.
they give you 5 years. So you take a written board exam first. You pass that, and then your clock starts. You get 5 years to submit five cases, and you think, oh, that's no big deal. Five cases, we got this. They are literally all about case selection and finding that needle in a haystack type of patient. So it took me the total of 5 years to complete this journey, and I'm still not done. I still have my oral board exam, and then that I can finally put it behind me.
So I'll tell you a funny story because I started this journey a long time ago and I had this great case. It was like the hardest case. Everything was great. You know what got me was the camera setup. I mean, I had gone over the raw,
Oh my
everything
gosh.
in raw so many times, and that just completely discouraged me. And then I ended up doing a million other things. But I have a huge, huge respect for people who go through that accreditation process because I couldn't even get past raw images on my camera. It was a great
Cameras,
case. It was a beautiful case. It was a beautiful
yeah.
case. But so anyway, so
Cameras are
you,
everything. Yeah.
yes, and like I said, I did meet Tiffani through. We were both COIS graduates, and you've been
Mhm.
on another podcast before too, and we talked about that journey and just meeting inspiring people. And Tiffani has also joined as one of our clinical ambassadors at the Dental Advisor too. So you'll be seeing a lot more of her, hearing a lot more about her story, and she's an educator. She publishes, she lectures, and if you need her in a city near you, let us know. Contact us at
Woohoo.
Dental Advisor, definitely. So today we are going to be touching upon a little bit, it'd be good to gain a little bit of insight on how you started your practice, where you were, and then just kind of talk about your transition from an analog type practice to a digital practice. And you did graduate, I think, just a couple years after me. You're 2009, so you've been graduating for a
Right.
good 16 years. So tell us about your
Right.
journey.
So my journey started, 2009, right out of school, and I ended up working for a big DSO company and out here in Hawaii, and I was stayed with them for about 10 years until I decided to part, and I went to a smaller group practice that was owned by an orthodontist, and it just had a bunch of general dentists and every kind of specialist, but it was kind of a smaller size DSO in a sense. And that was nice, but there was never any availability for a partnership. So I knew one day I would want to branch out. And after I got, COIS and all of that under my belt, I wanted to do things a little bit differently than maybe the standard, practice does. And so I ended up purchasing my private office in 2022. So I'm fairly new to business ownership. I'm 2.5 years in now. So yeah, it's been a great journey and a lot of learning. And I definitely started out, I would say, until about 2017, doing everything analog. I mean, talking about single crowns and analog, just, the quad tray and send it off to the lab and put them in a temporary and bring them back in for delivery and renumb them up again. And, how much
Yeah.
time was wasted, it feels like, doing posteriors like that. So yeah,
And
now
did
it's
you
all
have a
digital.
favorite tradition? Did you have any good materials that you liked using when you were doing analog, when you were taking traditional impressions?
I'm kind of partial. I really like clinician's choice.
Good. Yes.
Their products. I love the way that they handle. They have this template, which is amazing, and their affinity is awesome too. Just it's just a nice tactile. But I love Kettenbach. I love their futar for blue moose. It's
Yes,
great.
definitely.
Hmm.
So you start, and you're saying you're 2.5 years out, but when I came to lecture for the Seattle Study Club in your hometown, I got to see your practice too, and it's beautiful.
Yeah.
And you've done a
Thank
beautiful job. If
you.
it's only been 2.5 years, you'd never know. So you have now adapted onto, so you started your practice, inherited the PrimeScan CEREC system,
Correct.
correct?
Correct. Yeah.
And then
So,
you had to go in and
yeah.
make a big purchase also. Did you have to, like, what was that? Tell me
Right.
what that day was like when you're like, okay, I'm going to spend a lot of money, not on me,
It
but as
was
an investment for my patients and for treating my patients.
right, right. And it is. It's like who's you are the owner and you're the boss, but who's the last person on payroll that gets to be paid, right? It's
Exactly.
us because everything else comes first. So, yeah, I just had to bite that big loan off and decide I'm going to do this because I know the ROI, it will come back. And this is a machine that I'm going to use multiple times a day. I mean, that machine probably, we do about 3 to 4 a day, which is really
Mm-hmm.
pretty decent for, a single doctor. It depends on, if we do quadrant dentistry versus but we always aim for about some sort of 4 porcelains of something a day.
Now, how do you schedule that? Like, how long are the patients? Because they call it same day dentistry. I mean, I do know some people that have had the patient come back, which just seems like you're not getting the benefits of doing a chairside system. But
Right,
what,
right.
what does it look like when you're, I guess, what does it look like when you're scheduling the patient?
Yeah, so I have 4 operatories, but I pretty much only operate out of two. And so it's all about staggering, and there's a little overlap in them. Some days we have really heavy days where we just knock it out and we're doing like, 8 in a day, but it's because people want quadrants. So
Sure.
that's obviously going to take up a big chunk. And so then the second chair will be a little bit lighter. So it's all about the balance and being able to sometimes we can bake things together if we have it
Hmm.
timed just right. So it's just,
So
yeah,
who is, I guess, I know people are probably wondering, like, who is designing these restorations? Is it you?
me.
Oh, wow. Okay. That is impressive then that you can get those many restorations done and still manage the hygiene checks. But I mean, I guess it's nice because earlier on in my career, I was in a group practice and we did have a CEREC and the E4D at the time too. But what
Okay.
we'd done at that time, because it was just a busy practice, is we had someone dedicated to learning just how to use that machine
Right.
and design and fire. And it was, you know, it was tricky, but I can see how if you're really good at it, I think on your own it would be a little bit different because you have more control over the schedule and
Right.
especially if you enjoy doing it too.
I do. I mean, there's just that instant gratification of like, okay, well, this patient had packed food and complained about the previous crown that was there. Well, obviously, I'm going to look and see where it was on the radiograph and see why it did that. And okay, I can make it a little bit different shape, and it's gratifying.
Yeah, that's, and right now for the people that aren't like myself, I mean, we're making notes, please have a patient has current food contact, between 18, 19, make sure you have a broad, wide contact. And, then I'm adjusting. So I can definitely see the benefits on so many levels and, it's interesting because there was a big push for these chair side systems in the early 2000s. I used to even go and be a lecturer for the CEREC doctors on materials. And then it kind of, came down a little bit. And now I'm kind of seeing a resurgence of people asking about, and I was just at a symposium for a company recently, and there was someone next to me who's a colleague who you know too, and they were saying, what do you think about is actually the prime scan system? And he's been out for about around the same, somewhere between 15 and 20 years. And it's interesting to see that people are kind of getting back into it, whereas it seemed like DSOs were kind of taking over, and now we're seeing a lot more people coming. Maybe not a lot more people, but I also in my own solo practice. But it's interesting to see, and I didn't know what kind of advice to give somebody who's been out doing it for 15 plus years. So do you have any advice for someone who's, you know, debating making that big purchase?
I think I have zero regrets. And
Awesome.
the amount of what I can offer that patient in the same day, there is a little hiccup of a learning curve. I will be honest with you. Does everything go perfect every time? No, we still remill things. And we're
Hmm.
usually, I mean, but a mill takes about 15 minutes tops. So it's not like you're, oh my gosh, send the patient home. I gotta, bring them back another day. Usually almost everything is correctable in that visit. So that's kind of that peace of mind. And you are still doing the patient like a really great service.
Huge, huge
Hmm.
service. And if you don't like it, you can redo it at the time, right? I mean,
Yes,
you could, there's so many things because
that's
we're not all perfect, right? I mean, there's things
right.
that you, do you have any of your assistants or anybody else kind of helping with the scanning? What are you doing?
Yes.
Okay.
So basically, I don't scan. So my assistants will
Perfect.
scan and then they will outline the margin for me the best that they
Awesome.
can. And
Perfect.
then they bring that scan to me, and then that's when I design. And it takes me about 5 minutes to design, and then boom, it's off. Then I train them so they will stain and glaze, and then they get their
Awesome.
own little hands dirty, and they have their own pride, and it brings them great joy too because now they've, made something custom for this patient.
That's amazing. Yeah, just giving them, empowerment and doing something like that. It really does. I've seen that on the
Absolutely.
other side too. So now, what kind of materials are you milling?
I'm mostly doing Emacs.
Okay.
I love a good lithium disilicate. It's
Same.
beautiful. I mean, cosmetic, it's strong enough. I mean, once in a blue moon, would I do some zirconia just because you have that bruxer that comes in and it's that second
Sure.
molar and, but the majority I do a lot of Emacs
And what
for
kind of
sure.
restorations are you primarily doing?
Well, I do replacements of crowns, but I don't prep really crowns ever. So I'm doing a lot of onlays, three quarters, things along those lines. I just don't, I don't want to say I don't believe in them, but now I've kind of started a different path and a different journey with
Ooh,
biomimetics.
okay.
So
Tell us about that. Ah,
it kind of came across me a little bit blind. I wasn't planning to do anything else. I had done the course. I'm doing the AACD, and I thought, well, what more do I need to do? I had, inspiration from Dr. Amanda C. I think most of us know her. She had
hmm.
spoken really highly about one of the very first anatomy classes she ever took was with Pascal Manier. And if I think most of all of our listeners probably know who Pascal
Yes.
is. And I had his book from like forever ago, and I always admired. It was amazing. And I found out through one of my friends, Dr. Alexi Agil, if he's listening, I don't know, but he talked me into doing this residency out of Beverly Hills Dental Lab. And Dr. Pascal was offering 5 courses to do this program, and you basically will be biomimetically certified after you show your hand skills, and you can go further and do a paper, do a little research, and really do the whole shebang. So of course, naturally, that's
What
what
else
I'm
can you add
doing.
to your CV?
Might as well
I
bring it
know.
on. But
She's
yeah,
also
and so
running for president in,
so I
2028.
started that. I'll be finished with that I think by September next year. And
Awesome.
it's just totally rocked my world. It's really just an amazing outlook on how to just conserve that enamel. And I think that's the one thing. I don't know how dental schools are teaching now, but what I think probably you and I learned, it was just very much, oh, you broke a cusp, compromised tooth, put a crown on it. That's just kind of your bread and butter. And there's just so much more. It would just kill me trimming down that enamel. And I just knew that there would have to be a better way. So, yeah, so
Awesome.
it's really just been
That really
wonderful.
does go hand in hand too. I don't know that everybody who thinks about, getting one of these full, chair side mills also thinks, I mean, that's a great way of incorporating what you're learning with the minimal
Right.
conservative dentistry. It really is. And it probably saves you a lot of time too. You're not packing cord probably as much. Do
No,
you even
a,
pack
l-
cord?
Yeah, a little bit. When I'm replacing crowns, you have to. I mean,
Sure.
most of the time. But no, most of my margins are Supra. Everything's super hygienic. It's great. I mean, it's clean. It's pretty. It's
Yeah, and you
it's
can see
what
your
I would
margin.
want in my mouth. Yeah.
I love that. Now, are there times when you find that you're still hanging on to your traditional impression materials? Like when are there times that you're like, you know what, this is just, I mean, there's a beautiful thing about
Huh.
digital dentistry, but sometimes there are situations, what are those for you?
Absolutely. When it comes to the cosmetic aspect, so say I'm doing veneers on like we call them the antisocial sex, like you don't want to do the sex, right?
Right, exactly. Do the
But
four or the eight.
that's right. And so, say we do something along those lines. It's just so soft tissue sensitive that for
Yeah.
me, yes, I will definitely scan and give the lab a scan just so they can have that. But it is all about, I will take two full mouth
Hmm.
impressions, old school style. I still do that to this day. There's just something about the tactile for the lab to be able to handle and I'm not the one making it, but if this is what they want, this is what I'm going to give them to get
Yeah,
the
and
best
and
possible
that is the
product.
beautiful thing too. I'm similar whenever I'm doing a full mouth. I mean, we'll take traditional impression, we'll take one, we'll take two, and then also submit a scan too, and submit a scan of the temps.
Absolutely.
I mean, the more information you can give them, the better, and they
Yes.
love it. The
Yes.
photos, all of it, and it's just we
Hmm.
didn't have that capability before. We would have to take, two or three or four impressions just to make sure we captured everything that they needed. Or,
Absolutely.
last thing you want is to have that patient come back and say, "We're going to remove your temps, and we
And
need to take another
redo
impression."
it again. Yeah,
Right? Yeah, that would be a no-go.
for
And
sure.
so, are you also looking to get into, put 3D printing? Is there anything like that that you're starting to incorporate
Yeah.
into your office or thinking about?
Absolutely. I cannot wait to get my hands dirty with that, but all in good time. So I'm
I,
thinking, I have a lot on my plate, but
yes,
that is something that for sure I am waiting for that little right time, maybe when the Sprint Ray has a nice little special, little exocad
yes,
here. And, I
yes.
have to get my team trained. That's the big thing. So it's just kind of trying to coordinate that because if I go all in, I want my team with me. So then that way I'm not just walking through the dark by myself. Maybe if I remember something and a team member remembers something else, we can kind of
Yeah.
go
And,
through it together.
I think what's nice too is those of us who've waited a little bit, maybe to incorporate all the pieces, it sounds or it seems like I'm hoping that they're all figuring out a way that they can work together, making it more seamless for us. So it's
Right.
like we don't have to like piecemeal this and this and this and that. There's
Wouldn't that be
technology.
amazing?
I
I'm
know.
so
We need
ready. I'm so ready.
they needed to be a little bit quicker, but
I know.
hopefully they're listening just a little bit quicker.
All in one program, all in one machine. That would be great.
Yes, and not very expensive.
Right. Affordable.
Yes.
You would dominate the world.
All of our world. Okay. So you get the hint there. Any manufacturers that are listening. So in Hawaii, in your area, are there a lot of people doing, are you able to market this as same day dentistry?
Yes, we do. I mean, we do it on our website mostly, and Google. Google has been patient reviews is what I go after. Forget Yelp. Yelp is like nothing but
I know.
complainers all the time. It's terrible. And Nextdoor. Have you heard of this app? It's a brand new app that's kind of out there now, and woo, it's like a new Yelp.
Yeah. No, we've been next door in it for a long time over here in the in the
Yeah.
in the land of the states here.
Oh, see, it's a newer, I would say in the past 2 years, it's just kind of boomed in Hawaii. So
Okay,
yeah,
yeah.
it's
So
an
it's good though.
interesting
I
little
mean,
one.
if you want like plumber, if you need it, yeah, if you need it done,
Right,
yes,
right.
yeah. So, but if
So,
you get accredited, I mean, you're
hmm.
gonna be one of 500
In the
clinicians
world, as far
in
as
the
I know,
world, which is
yeah.
amazing. You've got this going for, you got your full CAD CAM system. I mean,
Yeah.
you're really killing it. So are there any shortcomings or are there any okay, so that you said no regrets, zero regrets.
Mm-mm.
Is there any way that you would have maybe marketed it differently or implemented it differently into your office when you purchased it? Or is it just, did everything really would you have taken more courses? Do you wish that you had gotten more, longer warranties, better support?
Oh, always longer warranties. That's a
Yes.
given. They
Yes.
usually give you a year warranty or something along those lines, but inevitably it is, just like your car, something wear and tear, it's going to happen. So it's fairly inexpensive, knock on wood. Of course, now I say that and
I
to fix whatever's going on.
right.
So,
Exactly.
but yeah, I don't have any regrets. And most of my patients have already, because like I bought the practice and the new patients that come in, I mean, the existing patients already knew that was there. The newer patients, we tell them that and they're comprehensive if they do need some sort of restorative work that we will be doing it same day and their light goes off. Wow, I don't have to come back.
I know.
So
I
it's
know.
really nice. Yeah.
It's definitely, and if you're good at it and you can, when you're looking at those x-rays, and they look good and you feel good about what you do, that's
Oh
the best
yeah.
thing, right? I
It's
mean,
like,
that's,
how do you sleep at night? Like that,
I
that's
know, I
my
know.
post-op x-ray for me is like, huh, I can go to sleep. It's great.
I love And now, are you doing any, um, what kind of cement are you using when you're
I predominantly use Variolink when I do
awesome?
just I like materials to
Ivoclars.
materials. Hmm.
So, is there any final kind of words that you want to share with us about what, to anyone again? So, probably, how about people who are newer in their career? Is there any recommendations, any courses that you would
Sure.
recommend?
I would recommend you seeking out your local. There's probably a CEREC study club in almost every town, every city that's close to you. They have a lot of online, but there's nothing like it to be able to have the hands-on. So if you could join and sign up for one of those, and depending on who the sponsors are, if it's a Shine, a Patterson, sometimes they'll back it up, and it can be free sometimes. Out here, it can be free. So,
Nice.
yeah, it just depends on who's hosting. So I would get your hands dirty,
Okay.
play with the equipment first, talk to other dentists that are currently using it around you, and step up your game. You're gonna love it. You'll have no regrets
I love
for
this,
sure.
Tiffany. You're making me regret it now of not having one.
I only
I
regret
know
that I
I
didn't do
might
it
have to make a
sooner.
big purchase. I know. No, it really, it's so many things that you kind of brought together for us, and especially and it's not just same day dentistry. It's you can be conservative, you can
Hmm.
and just things are a lot quicker than they used to be. So we really appreciate,
Absolutely.
your
Yeah.
time, and for anybody, you really made it fun. And like I said, I bet you there's going to be a lot of people. And I have to give a shout out to the CEREC docs, and they're a good group of friends of mine, and they do a really wonderful job, and they're still working at it every day. I mean, they've got such a great group of people that are working to get education out there, and you're absolutely right. They are really killing it in that area, and the support is really good. And so I think that they definitely they've continued to stay on their A game. So, thank you
For
all for
sure.
listening today. And if you'd like any more information about the dental advisor or anything that we've evaluated or talked about, or to get Tiffany on your lecture circuit, please visit dentaladvisor.com, and we will see you next time.
Thank
Aloha.
you. Aloha.